So let's now talk about the gastric bypass procedure. So the gastric bypass procedure is considered the gold standard by many because of a long tracking history of good success. It works by restricting the amount of food that the patient can take, but also creating a small pathway of malabsorption that will further the weight loss for the patient. The main advantage of the gastric bypass is the weight loss, which is sustainable over the years. Another advantage for the gastric bypass is that it's very successful at correcting other problems that the patients may have, primarily metabolic problems such as diabetes. It is a permanent procedure. That means that you achieve durable and sustainable weight loss. So one of the disadvantages of the gastric bypass is that the patient needs to be committed to lifelong vitamin intake and supplementation. Should you fail to follow these guidelines, you may become deficient on some of the nutrients. The most important nutrients that you have to take with a gastric bypass include calcium, iron, and vitamin supplementation, especially vitamin B1, D. Most patients with a gastric bypass experience anywhere between 60% and 80% of the excess weight loss. This is very satisfactory weight loss on the long term. It also helps achieving resolution of medical problems including diabetes, hypertension, and sleep apnea. The sleeve gastrectomy is also effective at achieving resolution of these problems, like the gastric bypass. Patients with a gastric bypass could lose probably 5 to 10 more pounds than the sleeve gastrectomy for every 100. That being said, for most patients, the weight loss between the sleeve gastrectomy and the gastric bypass is quite comparable. So when choosing the gastric bypass versus the sleeve, many conditions come into play. Patients that need portion control may be very well served with a sleeve gastrectomy, whereas patients that may need extra control, especially with sweets, probably a bypass may be a better choice. There are other conditions that could affect the decision of the patient, and those include the presence of severe gastroesophageal reflux disease symptoms, the presence of a condition of the stomach, such as a lazy stomach in gastroparesis, or primarily is a patient's choice. You can decide on the procedure that you prefer. The expectations prior to a gastric bypass are similar to a sleeve gastrectomy, since they're both considered bariatric surgery. Before the procedure requires the same preparation, the checking medical labs, medical workup to make sure that you're suited for surgery. After the procedure, you follow the same guidelines as far as nutrition and follow-up, including regular checkups with a specialist, 2 weeks, 6 weeks, 3 months, 6 months, 1 year, and every year thereafter to make sure that the ranges of nutrients are within normal levels. So the gastric bypass is performed in the hospital. We're going to show you a quick video presentation about how the procedure is performed so that you can have a better understanding of its functionality. So in this video animation, you can see an example of how the gastric bypass procedure is performed. Similar to any other minimally invasive surgery, small punctures are created into the stomach that allows the surgeon to place specialized cameras and instrument to visualize the inside of the patient. We have the stomach, which is a large container, 2 to 3 liters of food at once. We turn it into a small pouch of the stomach. We then perform a reconnection of the intestines to create a pathway of malabsorption. This enables the patient for further weight loss. So the bypass primarily works by 2 different mechanisms. It restricts the amount of food that you can take, but it also creates a small pathway of malabsorption. Bypass by definition means that the food is rechanneled to a different pathway. Ultimately, the juices of the intestines and the food mix for a normal absorption. As you can see in the video, since the gastric bypass changes the anatomy, compliance is strict. That being said, if a normal person requires 100 milligrams of a certain vitamin, a patient with a gastric bypass may require 150 to be able to maintain the levels. If the patient is compliant with the nutrition and the vitamins, they will have no problem on the long term. So the gastric bypass is covered by insurance, but once again, the policy has to be the right one that has obesity coverage. The cost of a gastric bypass surgery may go in the range of $12,000 to $30,000. But for the patients that are private or self-pay, we do have affordable options for a gastric bypass.